tell me what happened and why you chose to come. And how did you choose us compared to the other people?
So I was looking up and Malligai Dental Academy was like the first on the top, I think because of your reviews or your ratings. It was a pretty nervous experience because you're dealing with a machine, whatever it is, and it was a good experience. And I learned how to tackle the access opening and how to control the speed and how to do the obturation. It was a good experience.
Hello viewers, today we have a very special guest with us, Dr. Anisha, Deborah. She is a periodontist and she wanted to improve her rotary endodontic skills. When she approached me, she had a lot of doubts about her abilities to perform RCT because being a specialist in perio, she was not having any experience in endo. So she wanted to gain the endo knowledge and she wants to improve on it. So we are going to hear her story about how this experience at Malligai Dental has really helped her. Hello doctor. How are you?
I'm good.
Thank you so much for coming to Malligai Dental first of all.
Yes,
And I remember you called me in December and you were asking for an admission in the course. So tell me what happened and why you chose to come and how did you choose us compared to the other people?
So,
You want to know the before story first.
So basically, I had finished my MDS in periodontics, and then, like everyone, we were confused what to do. So I took up a job, and then, due to personal reasons and maternity break and all, there was a 4-year gap for me. I
4-year
had
gap after MDS.
after MDS.
Okay.
So I
So
had,
you passed out BDS in which year?
BDS was 2009 to 14
Which college?
in Savita Dental College.
Okay. So you did any RCTs during that time?
We had done a few RCTs, a few anteriors we had done, and they gave us a few premolars, but we hadn't done molars, and we weren't very confident with that. Internship, like whatever they taught us, that was it. Then I immediately joined MDS after a 6-month work
Okay.
stint in a clinic, and
That
was
is also in Savita.
that was in Ragas.
Ragas. Okay.
In Ragas Dental College, I did perio from 2015 to 18. And then I worked for 1 year in CSI Rainey Hospital, and that I gained a little confidence there. Then, as most of the women of nowadays, have to start a family after marriage. So, baby number 1, baby number 2. So 4 years adliye poichu. I totally lost my confidence in Solalam. I was not very confident with my dental skills, because I was like full-time mummy job for 4 years. And then I thought, okay, now the kids are a little older. Why don't I step back into dentistry? But I didn't know where to start. If I go for a job, if I'll be confident enough. And because after all, it's a patient who's giving their health and their teeth into our hands. So I thought, let me look around for some courses which will help me to refresh what I've learned in 8 years of dentistry. So I was looking up and Malligai Dental Academy was like the first on the top, I think because of your reviews or your ratings. So, okay, let's see. And plus I knew this place from before, Dr. Vesta Lydia. She's my cousin and she had done her boot camp, I think, from you a few years ago. So she had very much recommended your place and she had recommended you and the motivational speeches you give and also.
I think otherwise also you are my Facebook friend.
Yes, sir.
She must be following all our activities.
Yeah, not very much, but I am not very active on social media. But yes, I do know the place.
Okay, I have a question for you. So after you thought about joining the course, like when you went and approached your family, say your husband, like how did they react? Like after 8 years of study, do you still want to go and upgrade? What was their say about this?
They were a little apprehensive in the beginning. Are you sure you want to go back into studying? I said, this is the best option for me now because I can't go into a full-time studies like 6 months, 1 year, because I was looking to get back into work as such, where I earn something for the family, because I've been studying and I wasn't really contributing to the family income till now. So I needed to start somewhere. So I was looking for short-term courses, and when I contacted you, you had said that we do have such courses where you can get trained in a short period of time with the best available.
So when doctor approached me, she was very keen on doing Rotary Endodontics, and also she wants first-time training in extractions. So we'll ask her experience in extraction part. Like when you came, I think there was a course which we have planned for somebody else on extraction and exodoncia. So you joined that batch and you did some couple of cases and you did assist the other doctor. So how was your extraction course experience?
The extraction course experience was very good. It was very professionally planned and coordinated, and I learned a lot from you, sir, and from the other doctor as well. The impaction course was going on, so that was a very good thing for me because I was able to assist her and see how she's doing. And when the cases were allotted to me, the regular extraction cases were allotted to me, they taught me right from LA, because it was 5 years since I'd given LA to a patient. So it was a very nice experience, and I was able to smoothly do the transition from being not able to even know whether I'll be able to get back to doing a patient work, to being able to know that I can deliver what the patient wants in a pain-free manner. I was more confident, definitely, after those 3 days of that extension.
Even I could see a lot of change in her confidence level before and after the course. Before, she was quite skeptical about her development in the subject. Like she was questioning a lot of things, like whether she'll be able to handle cases and things like that. So when she came for the extraction course itself, I made sure that she got the basic knowledge of a local anesthesia and other things, so that she can confidently do any patients without having any pain or anything. And moreover, she was very lucky also, I can say, because one doctor from Australia, Dr. Alfia, she came for her course. During that course, dear doctor came, Anisha came and did so many cases she assisted, and she saw real hand. Like a couple of days we were running the course, and it was quite a bit of experience. Coming back to Rotary Endodontics, doctor, like what was your experience during your first case?
So that was my first time that I was doing Rotary as such, because they never taught us Rotary in BDS. So Dr. Gomati was guiding me for my first case, and it was a pretty nervous experience because you're dealing with a machine, whatever it is, and it was a good experience. Sir. I learned how to tackle the access opening and how to control the speed and how to do the obturation. It was a good experience.
And she had a lot of family commitments and other things, like we have to accommodate those requests from her for some breaks in between and cases allotment, and there are so many things. We are very good in customizing that, and hopefully it helps the participants. We are not very hard pressing them on attendance or anything like that. We are quite flexible because we know if they don't perform well, they are the losers. But we make sure they do the required quotas and they complete. And she has submitted her case record today, and a lot of efforts have been put in this. In organizing the course, during the course, and even after the course. It's quite a tough task for us also. You can see quite a number of cases she has done, right from the pre-op photograph and till the obturation. The cases are given to her, and she did everything on her own. And it's quite impressive, Anisha, to see all this,
Yes.
and to see the amount of hard work you put. And she has written nicely about her cases, from the history to the follow up and recommendation. And I want all of you to understand that, even though you do a 3 months course or a 2 months course, the way we train you is purely practical. On patient, we don't focus much on the theory part, because all you have completed already, you would have completed everything in theory. And the only thing is that real hand experience on patients is must. Tell me something interesting which has happened during the course of your training.
Um, Interesting in terms of
Anything with the patient, any cases, anything which you found little amazing to see, or any case experience
talk to remember.
you don't remember.
But every case was a special experience. So every case, I learned something new.
Hmm.
And one case, I felt it may have perforated when I was doing a lower molar. And Dr. Vaishnavi, especially, I have to mention her. She instilled a lot of confidence in me. She gave me a lot of tips on and tricks on how to locate a canal, how to know if there's a perforation. A lot of small tips which you will never learn in any college. They don't have the time to sit with each person like this. And she's very experienced in what she's doing. She's very good. And I was very impressed with all the theory classes that were going on, because some academies focus only on patient work, but the theory part is also important. Theory part in terms of practically also, and how to deal with practical situations. They took theory on that, so it was not too theoretically theory that way. So so she taught me how to find out whether it was a profession. Luckily, it wasn't, but she was there guiding me throughout the case, and I think that was a good experience to know how a perfect, because I had done about 14 cases. So in that, to see how it would be to perforate and how to repair it, it was a good experience, I would say.
Good, good. So I'm very glad to hear all this because Dr. Vaishnavi and Dr. Gomati, all these people have completed, either they will be experienced dentists in root canal or they'll be having some qualification like FDS in Endo. And I employ such people and empower them to train the new doctors, and it helps them also. So, moreover, concluding our discussion here, what do you like to give us? Any particular feedback you want us to improve on it, or you want to say something about our training? Anything you want to add up?
I think the timings were pretty flexible, in the sense when I was putting forward my needs. My son is not well, or I'm not well. You were very accommodating, and
Maid was not coming.
maid
home
was
today.
not coming, babysitter was not coming. So you
So
were
I think
very
we have to arrange
accommodative.
next time some maids and babysitters for our students.
For the
Last
students'
people,
kids.
I know.
It was a very difficult task, I would say,
We have to build a whole ecosystem.
juggling family life and kids, and coming here 9 to 5. But the it was a very flexible overall, and I was very comfortable coming. Uh, to improve, I would say maybe uh, when I was there, the patient flow was a little diminished in March, I would say. It felt like I was prolonging my course, but in April the flow picked up. So of course that may not be in your hands, but I'm just giving a feedback. So I felt that the beginning first few days was very slow, but after that it picked up pace, and I was able to finish within a month's time. Otherwise, equipment and all is very good, and the training is very good.
So, dear viewers, if you are a lady who have got a long break in front of you and you are doubtful about your skills, whether you'll be able to perform cases again, and you won't believe today even one periodontist came from somewhere out of the blue. She was sitting in front of me. She just came randomly, and she said, "Sir, I'm a 2000, I think 7 or 6 pass out BDS. Completed my MDS in 2017, both in government college." And she said, "I'm not confident now because I had a long break in between." So I want to tell you something here. I have trained a lot of people, like people who got a lot of big breaks. Definitely I know how it will be. Like 3 years, 4 years is such a long gap when you don't touch patients regularly. Even she said, "Sir, last week I joined a clinic and I was almost froze. I was frozen when I took up a case. So I quit that thing and came out." So such people, I don't want you to lose your hope. I want you to come here. We'll train you, give the simple cases first, and slowly get you into the complex cases later. And there are lots of people over the last couple of years have come and got their training here at Malligai Dental. Please check all the interviews we are regularly taking from all the completed course participants. Getting one review takes 3 months time for us. Like doctor was almost there for from January to till now, and it's very difficult for us to get even one review, one video. It's a big pressure for our academy, for our future. All these interviews are going to be very helpful for us in our future. Our vision is to bring more people for the training. As doctor said, bring more patients for their treatment, and make this model a great successful model, like a win-win-win model. We give treatments at a very good pricing, affordable pricing. And doctors also, we want to train not one or two, we want to train more number of doctors. What the system is already lagging, we want to fill that gap with real training, right, doctor?
Yes.
So I want to thank your dad, who is an ex-service officer from the Navy, and also your mom. My personal thanks to them. And they came, and I still remember I was busy doing things for my London trip. They were here, and they were really asking, very curious to make you join here. I was that time I was also a bit apprehensive because I'm going out of country and how things are going to be managed. And we had a lot of confusions happening that time when to start your course. So by God's grace, everything fell in the
Into
right
place,
right
yes.
time and right place.
Yes.
Thank you so much, Dr. Anisha, Deborah, and we recommend you to do more courses, not
Sure.
only here, in many places.
Yes.
Go to the right place and the right training centers and learn your skills, improve your implantology skills. Being a periodontist, you should focus on implant and lasers.
Yes.
Okay, that should be your goal. Do go to foreign countries, European countries, and other Western countries to learn better tricks. And I also would recommend your husband also to update his skills in CBCT guided surgery. He's a old medicine, right?
Yes. Yes.
Dr.
Medicine
Jason,
radiologist. Yes.
radiologist. So all this will be futuristic. New technologies have come in dentistry. So all this will be helpful. And if in case any doubts, you can always come back to us. You don't think that you have finished your course.
Sure.
This course, you can always continue chatting with us and get your doubts clarified. So thank you so much. Thank you.